study. You have no disclosures that are related to this study. Arthroplasty represents one of the largest hospital expenditure category for Medicare, especially in the United States. Annual costs are been varying. However, it's estimated approximately $23.5 billion every year has been spent on total hip arthroplasty. Preoperative patient comorbidity burden affects the postoperative complication overall in total hip and total knee arthroplasty. And the evolution of technology in total hip arthroplasty, specifically the introduction of navigation and robotic systems, it is expected to improve precision of component placement, decreasing postoperative complication, and hopefully improve patient satisfaction. However, in the current cost-conscious climate, investment in the computer navigation devices is being approached with caution. And overall, with any initial investment on any new technology system, it can be very expensive. Thus, the purpose of this study was to evaluate utilization trends, comorbidity burden, and reimbursements, 90-day global cost, as well as impact of different medical comorbidities on navigated total arthroplasty compared to conventional procedures. This was a retrospective study of using the Kimona private insurance database in the United States from 2008 to 2015. We identified all the patients based on the CPT codes and subcategorized those based on navigation versus conventional procedures, and looked at the reimbursement for the day of surgery as well as the 90-day global period. We further substratified all the comorbidities based on the ICD-9 and ICD-10 codes. Some of the most important comorbidities including the obesity, morbid obesity, hypertension, diabetes, AFib, and overall vascular procedure, as well as chronic kidney disease. We also used the Charlson Comorbidity Index for each cohort. We identified about 1,119 total hip which were navigated and 73,000 that were conventional. It appeared that there was an increase, significant increase annually in the number of navigated procedures performed. These patients were slightly less sick than, I would say, than conventional procedures using the Charlson Comorbidity Index. As you can see, comparing, there's the diabetes 3 versus 4, COPD 3 versus 4, CKD 4 versus 5. So overall, they were compatible. However, I would say the navigated was slightly lower CCI numbers. When looking at the results, there were no significant differences on the reimbursement on the day of surgery for conventional versus navigated. However, the navigated was cheaper. When we looked at the 90-day cost, however, there was a significantly lower cost using navigation system compared to conventional system for approximately $2,400 per case, and that was significant. When we looked at the various comorbidities overall, on the day of surgery, there was no differences. However, at 90 days, diabetes, AFib, and COPD were associated with significantly higher overall costs. When we compare those to navigated versus conventional systems, it is clear that overall conventional system was significantly more expensive compared to navigated system by approximately $2,400. And when we substratified those based on comorbidity, almost all comorbidity has affected the outcomes and costs have decreased in overall cost at a 90-day period. There were several limitations to the study. Overall, the sample size is still small. This is only using one database, which is a private database in the United States. It may not be generalizable to other countries or other insurance companies. Patient satisfaction was not assessed, so we don't know what the difference over there was. This was only a single database, and there might be a selection bias as the comorbidities in the navigation system were lower. In conclusion, medical comorbidities do affect the 90-day global costs. However, it is promising that navigated system did not increase, and it was actually result in lower overall 90-day costs. And this has implication for future and more new technology, which may have a profound influence on medical care during the next decade. Thank you.